What if one simple screening could help detect a disease years before it becomes life-threatening? Here's what I know from years of practice. Fear prevents more women from getting screened for breast cancer than anything else. Women avoid mammograms because they're anxious about what they might find. They convince themselves that if they feel fine, they probably are fine. They delay because the thought of breast cancer is terrifying. But here's what I also know. Breast cancer affects millions of women worldwide. And yet many people still don't fully understand what it is, who is at risk, and why early detection can make such a dramatic, life-saving difference. Today, I want to have an honest conversation with you about breast cancer. Not a scary conversation, not a conversation designed to create panic, but a real conversation with you about what breast cancer actually is, the warning signs you should never ignore, who's at risk, and the modern treatment options that have transformed outcomes. Because here's the truth. Knowledge is power. And when it comes to breast cancer, knowledge doesn't just help you. It can save your life. Let me start with the basics, because I think a lot of people are confused about what cancer actually is. Your body is made up of trillions of cells. Every single cell has very specific instructions. They know what to do, how to behave, when to divide, and when to die. It's an incredibly organized system. Cancer happens when something goes wrong with those instructions. A cell starts to misbehave. It doesn't follow the rules anymore. Instead of dividing when it should and dying when it should, it keeps dividing over and over. It multiplies without stopping. Think of it like this. Imagine a construction crew that's supposed to build a house and then stop. But the instructions get corrupted. Instead of following the blueprint, the workers keep building. They keep adding rooms. They keep expanding. They build structures that don't make sense and interfere with everything around them. That's what cancer cells do. In breast cancer specifically, these abnormal cells develop in the breast tissue. In the early stages, they stay in one place. But if they're not stopped, they can spread to other parts of the body, your lymph nodes, your bones, your liver, your lungs, your brain. Now, here's what's important to understand. Not every lump in the breast is cancer. Many lumps are benign, meaning they're not cancerous. They won't spread. They won't threaten your life. But some lumps are malignant, meaning they are cancer. And the only way to know the difference is to get it checked. This is why screening and early detection are so critical. If we catch breast cancer when it's still localized to the breast, before it has spread, the chances of successful treatment are dramatically higher. How common is breast cancer? Let me give you the statistics because they matter. Breast cancer is the most commonly diagnosed cancer in women. About 1 in 8 women will develop invasive breast cancer at some point in their lifetime. That's roughly 280,000 new cases every year in the United States alone. Globally, it's millions. Now, I'm giving you these numbers not to scare you, but to emphasize how important it is to understand this disease. Because of how common it is, it's likely that you know someone who has dealt with breast cancer. Maybe a friend, maybe a family member. Maybe you're dealing with it yourself, but here's what's encouraging. Survival rates have improved dramatically. 20 years ago, the 5-year survival rate for breast cancer was about 87%. Today, it's over 90% in many developed countries. And for early-stage breast cancer detected before it spreads, the 5-year survival rate is over 99%. Why the improvement? Better screening methods, better awareness, better treatments. When breast cancer is caught early, when it's still small and hasn't spread, outcomes are dramatically better. That's why this conversation matters. Understanding breast cancer, getting screened, and knowing the warning signs can literally save your life. Let me walk you through the signs you should never ignore. A lump in the breast. This is the most common sign. You feel something that wasn't there before. It might be firm. It might be hard. It might feel different from the surrounding tissue. Most breast lumps aren't cancer, but you need to get it checked. Changes in breast size or shape your breasts look or feel different than they normally do. One breast becomes noticeably larger or smaller. The shape changes. Skin changes. The skin on your breast looks different. It might be dimpled, like the texture of an orange peel. This can indicate that something's happening beneath the surface. Nipple changes. Your nipple becomes inverted. It points inward instead of outward. The nipple changes color. The nipple looks different. Nipple discharge. You notice liquid coming from your nipple. It could be clear, yellow, green, or bloody. Any unusual discharge should be evaluated. Redness or swelling. Your breast becomes red, swollen, or feels warm. It might look inflamed. Persistent breast pain. You have pain in one area of the breast that doesn't go away. It's not related to your menstrual cycle. Changes in breast skin texture. The skin feels thickened or has a rough texture that's new for you. Swollen lymph nodes. You notice swelling under your arm, near your collarbone, or in your neck. Now here's what's important. Having one or more of these symptoms doesn't mean you have cancer. Many benign conditions cause these symptoms, but you need to get it checked. Any persistent change in your breast should be evaluated by a healthcare provider. And here's something equally important. Some breast cancers don't cause any symptoms at all. You might feel absolutely fine and still have breast cancer. This is why routine screening is so critical, even when you're not experiencing symptoms. Let me talk about risk factors. It's important to understand that having risk factors doesn't mean you'll definitely develop breast cancer, and many people who develop breast cancer have no obvious risk factors at all. But understanding your risk can help you make informed decisions about screening and prevention. Non-modifiable risk factors, age. Breast cancer risk increases as you get older. Most breast cancers are diagnosed in women over 50, but younger women absolutely can develop breast cancer too. Family history. If your mother, sister, or daughter has had breast cancer, your risk is higher. If multiple family members have had it, your risk is even higher. BRCA gene mutations. About 5 to 10% of breast cancers are hereditary. They're caused by mutations in the BRCA1 or BRCA2 genes. If you have one of these mutations, your lifetime risk of breast cancer is significantly elevated, up to 70% for some women. Personal cancer history. If you've already had breast cancer, your risk of developing it again is higher. Dense breast tissue. Some women have naturally denser breast tissue. Dense tissue is harder to examine on mammograms, and it's associated with slightly higher breast cancer risk. Modifiable risk factors. Alcohol consumption. The more alcohol you drink, the higher your breast cancer risk. Even moderate drinking, a few drinks per week, is associated with increased risk. Obesity. Excess weight, particularly after menopause, increases breast cancer risk. Physical inactivity. Women who exercise regularly have lower breast cancer risk. Smoking. Smoking is associated with higher breast cancer risk, particularly in younger women. Hormonal factors. Taking hormone replacement therapy after menopause increases risk. Starting your period early or going through menopause late increases lifetime exposure to estrogen, which is associated with higher risk. Not having children or having them later in life. Women who have never had children or who had their first child after age 30 have slightly higher risk. Here's what I want to emphasize. Having one or more risk factors doesn't mean you'll develop breast cancer. Many women with multiple risk factors never do, and many women with no obvious risk factors do. This is why screening and early detection are so important for all women. Types of breast cancer. There are several different types of breast cancer, and understanding the type you have or the type you might be worried about can help you understand your prognosis and treatment options. Ductal carcinoma. In situ, DCIS. This is early-stage cancer that's still contained within the milk ducts. It hasn't spread into the surrounding tissue. It's highly treatable, and if treated appropriately, the prognosis is excellent. Invasive ductal carcinoma. This is cancer that has broken through the walls of the milk ducts and invaded the surrounding breast tissue. It's the most common type of breast cancer, accounting for about 80% of cases. Invasive lobular carcinoma. This cancer develops in the lobules, the glands that produce milk. It accounts for about 10 to 15% of breast cancers. Triple-negative breast cancer. This type tests negative for 3 common receptors: estrogen, progesterone, and HER2. It tends to grow and spread more quickly than other types, and it requires different treatment approaches. HER2 positive breast cancer. These cancers have too much of a protein called HER2. They tend to grow faster, but there are very effective targeted treatments specifically designed for HER2 positive cancers. Inflammatory breast cancer. This is a rare but aggressive type of breast cancer that accounts for only 1 to 3% of breast cancers. It presents with redness, swelling, and dimpling of the breast. The important thing to understand is that modern breast cancer treatment is highly personalized. The type of cancer you have, the stage it's in, your age, your overall health, all of these factors go into determining the best treatment approach for you. How breast cancer is diagnosed. Let me walk you through the diagnostic process, because understanding what happens can reduce anxiety. Self-awareness. You know your body better than anyone else. Being aware of how your breasts normally look and feel is important. Many breast cancers are first detected by women themselves, simply because they notice something different. Clinical breast exam. Your doctor feels your breasts and lymph nodes, looking for lumps or other abnormalities. Mammogram. This is an X-ray of the breast. It's the most common screening tool for breast cancer. If you're over 40, you've probably had one. A mammogram can detect breast cancer before you can feel a lump, sometimes years before. Ultrasound. If a mammogram shows something questionable, or if you have dense breast tissue, ultrasound might be used. It uses sound waves to create images of the breast. MRI, magnetic resonance imaging. This is a more detailed imaging study that uses magnetic fields to create images. It might be used in certain situations, like if you have a strong family history or if you're at very high risk. Biopsy. If imaging shows something suspicious, the only way to know if it's cancer is through a biopsy. A small sample of tissue is removed and examined under a microscope. If cancer cells are found, further testing determines the type and stage of cancer. Now here's what's important. If you're having a biopsy, it doesn't mean you have cancer. Many biopsies come back benign, but biopsies are the only way to know for sure. Modern breast cancer treatment has come so far. Let me walk you through the main options. Surgery. If you're diagnosed with breast cancer, surgery is often part of the treatment plan. A lumpectomy is surgery to remove just the tumor and some surrounding tissue while preserving most of the breast. This is often done for smaller, early-stage cancers. A mastectomy is surgery to remove the entire breast. This might be recommended if the cancer is large, if there are multiple tumors, or if you're at very high risk for recurrence. Radiation therapy. Radiation uses high-energy beams to destroy cancer cells. It's often used after surgery to ensure that any remaining cancer cells are eliminated. Radiation is usually done on an outpatient basis, several times per week for several weeks. Chemotherapy. This involves drugs that kill cancer cells throughout the body. Chemotherapy is sometimes used before surgery to shrink the tumor, and sometimes after surgery to reduce the risk of recurrence. Chemotherapy does cause side effects, hair loss, nausea, fatigue, which is why many women fear it. But modern chemotherapy is much better tolerated than it was years ago, and the side effects are usually temporary. Hormone therapy. Some breast cancers are fueled by estrogen. Hormone therapy blocks estrogen or suppresses estrogen production. It's often used after surgery to reduce recurrence risk and is typically taken for several years. Targeted therapy. For HER2 positive breast cancers, there are medications that specifically target the HER2 protein. These targeted therapies are highly effective and have dramatically improved outcomes for women with HER2 positive cancers. The combination of treatments used depends on many factors: the stage of cancer, the type, your age, your overall health, and whether you want to preserve your breast. Your medical team will discuss the options with you and help you decide on the best approach. I want to talk about something that's often overlooked in medical conversations: the emotional toll of breast cancer. A breast cancer diagnosis can feel like your world is ending. The fear is real. The anxiety is valid. You might worry about your mortality. You might worry about how cancer will affect your body, your femininity, your relationships. You might feel angry or depressed. This is completely normal, and it's important to address it. During treatment, you might experience physical side effects that are challenging. You might lose your hair. You might feel sick. You might be exhausted. These physical changes can affect your mental health and self-image. This is hard, and you shouldn't have to go through it alone. Having a strong support system matters. Whether it's family, friends, a therapist, a support group, or a combination of these, having people you can talk to, cry with, and lean on makes a real difference. Mental health care should be part of your cancer treatment plan. There's no shame in seeing a therapist or counselor. Many cancer centers have psychologists and social workers who specialize in helping cancer patients navigate the emotional challenges. There are also wonderful support groups, both in person and online, where you can connect with other women going through the same thing. Sometimes the most powerful support comes from someone who truly understands what you're experiencing. If you're dealing with a breast cancer diagnosis right now, or if someone you love is, please reach out for emotional support. Your mental health matters just as much as your physical health. Let me tell you about Margaret. She was 53 years old when she had her routine mammogram. She felt fine. She had no symptoms. She had no family history of breast cancer. She was going in for her screening mammogram almost out of habit. The radiologist called her with the results. They'd found something on the mammogram. It was small, less than half an inch. It didn't feel like anything when she examined herself. She never would have noticed it. Margaret was terrified. When she came to see me, she was convinced she was dying. She couldn't think about anything else. She had trouble sleeping. She was catastrophizing. I examined her. I reviewed her imaging. I explained that the finding was suspicious and we needed to do a biopsy to know for sure. But I also reassured her that it was small, and if it was cancer, we had caught it very early. The biopsy came back. Early-stage breast cancer. Stage 1. It hadn't spread beyond the breast. Margaret had a lumpectomy to remove the tumor. Then she had 6 weeks of radiation therapy. No chemotherapy was needed because the cancer hadn't spread and it was responsive to hormone therapy. Today, 5 years later, Margaret is cancer-free. She still takes hormone therapy as a preventive measure, and she has regular follow-up screenings. But her life is back to normal. She's healthy. She's thriving. The thing that saved Margaret's life? Early detection. The fact that she got screened even though she had no symptoms. The mammogram caught that tiny cancer years before it would have become a serious problem. While there's no guaranteed way to prevent breast cancer, there are evidence-based strategies that can help reduce your risk. Regular screenings. This is the most important thing you can do. For women over 40, annual mammograms are recommended. For women with high risk, screening might start earlier or include additional imaging like MRI or ultrasound. Maintain a healthy weight. Obesity increases breast cancer risk, particularly after menopause. Maintaining a healthy weight through balanced nutrition and physical activity is protective. Exercise regularly. Physical activity reduces breast cancer risk. Aim for at least 150 minutes of moderate intensity exercise per week. Limit alcohol. If you drink alcohol, limit it. No more than 1 drink per day is recommended. Don't smoke. Smoking increases breast cancer risk. If you smoke, quitting is one of the best things you can do for your health. Eat a balanced diet. A diet rich in fruits, vegetables, whole grains, and lean proteins supports overall health and may help reduce cancer risk. Know your family history. Understanding your family history helps you understand your risk. If you have a strong family history of breast cancer, talk to your doctor about genetic testing or more aggressive screening. Consider genetic testing if appropriate. If you have multiple family members with breast cancer, or if they were diagnosed at a young age, genetic testing for BRCA mutations might be recommended. If you carry a mutation, there are strategies, more aggressive screening, preventive medications, or even preventive surgery that can help reduce your risk. Remember, these strategies don't eliminate risk completely. Some women who do everything right still develop breast cancer, and some women who do nothing develop it. But living a healthy lifestyle reduces your risk and provides many other health benefits as well. Let me address some myths that I hear all the time. Only women get breast cancer. Men can absolutely get breast cancer. It's rare, less than 1% of breast cancers occur in men, but it happens. Men should also be aware of breast changes and report them to their doctor. A lump always means cancer. Most breast lumps are benign. Cysts, fibroadenomas, and other benign growths are common. The only way to know if a lump is cancer is to get it checked. No family history means I'm safe. Most women with breast cancer don't have a family history. About 85% of breast cancers occur in women with no family history. So even if no one in your family has had breast cancer, you still need to get screened. Young women can't get breast cancer. Breast cancer can occur at any age, including in teenagers and women in their 20s. It's less common in younger women, but it absolutely happens. Mammograms cause cancer. Mammograms use a small amount of radiation, but the dose is very low, and the benefit of detecting cancer far outweighs any potential risk. Breast cancer is always fatal. This is absolutely not true. Most women diagnosed with breast cancer today survive the disease, and if it's caught early, the survival rate is over 99%. A breast biopsy spreads cancer. This is a common fear, but it's not true. A biopsy doesn't spread cancer cells. It's a safe procedure that provides crucial diagnostic information. Here's what I want you to take home from this conversation. Breast cancer is serious. It's the most common cancer in women. It affects millions of lives every year. But it's also highly treatable, particularly when it's caught early. Modern treatments are increasingly effective. Survival rates continue to improve. And most importantly, you have control. You can get screened. You can know the warning signs. You can take steps to reduce your risk. You can make informed decisions about your health. Knowledge is power. And when it comes to breast cancer, knowledge doesn't just empower you. It can save your life. Fear should never prevent you from getting screened. If anything, let your fear motivate you to get screened, to know the warning signs, to stay aware of your body. Because the most powerful tool against breast cancer isn't fear. It's awareness, early detection, and action. If you have risk factors for breast cancer, talk to your doctor about screening. If you have symptoms, get them checked immediately. If you've been diagnosed with breast cancer, know that you have options and that modern treatment can give you a good outcome. You've got this, and you're not alone. I want to hear from you. When was your last screening? Has anyone in your family been affected by breast cancer? What surprised you most about this video? Drop your thoughts in the comments. Let's support each other in prioritizing our health. And if this video was helpful, please like it. Subscribe to Dr. Cameron Brooks for weekly health education videos that could change your life. Share this with the women in your life, your friends, your sisters, your mothers. Early detection saves lives, and spreading awareness could make a real difference. Thank you for watching. Take care of yourself, because you're worth it.